Um, and it says, I'm going to introduce you now. And I have the pleasure of introducing my personal acupuncturist, which Bill has been my acupuncturist now for what, about 2 years, going on 3, maybe, so
Sounds about
somewhere
right.
in that vicinity. And he's one of the reasons I stay as healthy as I do, and he's one of the reasons I feel as good as I do. So I am highly, highly indebted to Bill for this. Uh, he had served as an acupuncturist, he had served on the executive committee of the Integrative Health Consortium and was the former president of the Acupuncture Society of Virginia and the former vice president of the American Association of Acupuncture and Oriental Medicine. He's the author of over 150 publications and the editorial contributor of a book entitled The Scientific Basis of Integrative Health, as well as serving on the editorial boards of 4 national peer-reviewed integrative medical journals. Bill is an avid practitioner of Tai Chi and Qigong and is a board-certified licensed acupuncturist practicing at Inova Hospital in Fairfax, and the facility there is phenomenal. He has also spoken at national conferences, including the Integrative Health Care Symposium, where other medically known experts such as Deepak Chopra, Jeff Bland, and Joe Pizzorno and Mark Hyman were featured. And I'm very, very thrilled to have Bill as our speaker today, and who will give us carte blanche to ask him questions. So please, please be ready with your questions. So, and you're welcome to say anything, Bill, that you wish in the form of an introduction.
Okay, sounds good. Well, I'd like to start by saying that I'm trying to promote acupuncture and not my personal practice. That's my job here. If we had 400 people come tonight, I'm more interested in disseminating information on acupuncture and what it is and what it can and cannot do. And I'll start out just for basic questions that a lot of people have is what kind of education that we have. And that across the nation, it varies from state to state, but commonly it's a master's degree that is 3 years, a year of medical prerequisites after undergraduate. It's 3 years of school for acupuncture, 2 years of school of herbology or Chinese pharmacology, and a year of internship.
Wow.
Uh, we are practicing in 47 states at this time. There are a few states that still don't have practice laws, and that we have about 38,000 practitioners across the nation.
Right now?
So that can kind of paint a little backdrop.
I can't hear you. Wow.
So with that being said, I guess I can open it up and ask if you guys have any burning questions. And because there's so few people means it's more of an intimate setting.
Exactly. And I've okay, here's another one. Here's Carol coming in. And oh good. Hi Carol. The I'm gonna start off, Bill, because I've always wondered about this and I never really had an opportunity to ask you. Um, I don't understand meridians. And I know that I will tell you I have an ache across my back or an ache at my hips or an ache somewhere or other. And then you go to a point in my body that is in the middle of my um, thigh or in the middle of a calf or at the base of an ankle or something like that. And so I presume you're at a meridian point, but I never really understood meridians, as much reading as I've done. So would really appreciate you explaining that.
Sure. So there are 14 meridians on the body, which are pathways of energy.
Mhm.
And we believe, or the Chinese believe, that if you have a blockage or stagnation of that energy, kind of like a traffic jam, that it's going to present some kind of problem. And so let's say the traffic jam is in your shoulder, that would present in shoulder pain. So even though today we do know that it's a bicep tendonitis, an inflammation of that tendon, in Chinese medicine, they believe that the large intestine meridian, which starts on the index finger and runs up right through that area and ends right here at the nasolabial groove with 20 acupuncture points along that pathway.
Wow.
And so not all acupuncture points are on meridian pathways. There's 361 points that do lie on these pathways. And then there are extra points, and there's 40 of them by most styles and traditions that that do not lie on meridian pathways but have therapeutic value. And so they're usually Chinese words that we have to, the Chinese can just write a character very quickly. And that's the reason why instead of saying he gu for this point here, we say large intestine 4. It's the fourth point in the large intestine meridian. And so that I can influence your large intestine through this point, but because your lung and large intestine are connected, this point is also very good for allergies because it affects our lungs.
Mm.
So there's a book that's called The Web That Has No Weaver by Ted Kapchek. And it's a very good book. And he talks about how there's a web of symptoms and that it's the job of the traditional Chinese medicine doctor to connect the dots to create this differential diagnosis and then use the proper meridian pathway to clear the problem. So up until 1950, there was no scientific proof that these meridians existed. It was all just on paper, and that sinologists, or those specializing in the study of Chinese history, found a turtle that they carbon dated back to about 60 centuries ago, and it had a carving on the back of the meridian pathways.
Mm.
And some people say, well, what came first, the points, and then they connected the points and it became a meridian? Or do they believe that there was a meridian pathway and they realized, oh, by the way, there are points along the meridian that have therapeutic value? And that is up to debate. I've been involved in many deep historical discussions with that, looking at the ancient literature with people who actually read ancient Chinese. And it's kind of like the chicken and the egg. There's still no consensus on that. Getting back to the meridians and the scientific support, back in 1950, there was a Japanese scientist who injected a radioactive isotope into an acupuncture point.
Mm.
And what he found was that, lo and behold, that liquid ran right along a pathway of energy, which is very interesting because there's no structural element, there's no lymphatic vessel, no blood vessel, no nervous tissue or nerves that ran along that pathway. Then he injected it into a non-acu point and it just slowly spread within the tissue. And so then some electrical engineers got involved and said, this is really interesting. And they would find an acupoint, and they found that there's a drop of impedance or electrical resistance of the skin right on these acupoints. And then they mapped out the whole 361 points.
Wow.
Then someone came along who was into acoustic engineering, and they took a tuning fork and they touched it right on an acupoint. And as you know, that goes right up through here. And then they took a very sensitive instrument that's similar to a stethoscope, except it's got kind of a point at the end that measures the sound. And they found out that as they marched across the shoulder, as soon as they touched the meridian pathway, the amplitude of sound was louder. So they find that these pathways of energy transmit sound, they transmit vibration, they transmit a whole host of things. So it's quite an interesting thing. And the director of NCCIH, the National Center for Complementary and Integrative Health at NIH, her name is Dr. Helene Langevin. She was a researcher at Harvard, and she was researching fascial planes and found that there are fascial planes that go along the pathways of energy of the Chinese medical practice. And that's the reason why you can needle someone's ankle and have an effect on their neck.
On their neck. Yeah, that's fascinating.
I think so.
Absolutely fascinating.
And that was a spectacular question. And I should say that the meridians, each of the meridians are named after an organ. So I mentioned large intestine and pericardium. There's liver and kidney and heart and lung and sanjiao, which is the three jiao, or you may, if you've read anything about Chinese medicine, the triple burner. And that is an organ in Chinese medicine that is the upper, lower, middle jiao, and each one corresponds. Western medically, the upper jiao represents cardiovascular, your heart and your lungs. The middle jiao represents your digestive system, and your lower jiao represents elimination because you're a large intestine, and reproduction. And so if someone is trying to get pregnant, then we focus on their lower jiao.
Wow.
Yep.
Wow. Fantastic.
Okay, bring it.
I have a question related to what, did you say her name's Alice?
Yes.
Yeah,
yes.
what Alice
Susan
just,
talking.
yes, yeah,
Okay.
to what Alice just asked, Bill, which is that if you notice that you have sore points, for example, on your arm or your hand, can you press them? And is that, do you get a similar effect as you would with needles?
You absolutely can.
Mm-hmm.
And some people call it, well, you know, like acupressure, but
Mhm.
some people call it the science of sore points.
Mhm.
And you may notice that when something hurts, you almost automatically rub it. And what's really interesting is that if you have an issue with TMJ on your right, then you're going to actually massage the point on your left, and that releases this side because the meridians are bilaterally symmetric. They're a mirror image.
Mm.
And that there's many points that I'll check, and if they are tender, there's a point that's under the pad of your second toe, so not your big toe, but your second toe. If that's tender, then that could mean that you have cancer. And that's something that I haven't really had much of a chance to check. And even though I do work with life with cancer, I feel awkward to be poking people on the feet and saying, does it hurt? Does it hurt? Does it hurt? But that's what I've been told.
Interesting. Thank you.
Come on, Montine, you've got a big brain.
Yeah, I was sitting up here thinking about what I wanted to ask because, you know, I was thinking about what you said about checking for patients that have cancer, and I'm a cancer survivor, and I still have a lot of neuropathy in my toes from the chemotherapy. But I was also wondering about the seeds that you put in my ear last week, because Bill is also my acupuncturist. So I noticed that I had 3. I actually didn't know it was 3 in there, but can you just kind of explain how those work?
Certainly.
The seeds that you put in my ear.
Sure. 1 second. Let me see if I can get online and find a picture of the ear, because a picture is worth 1,000 words. And then, okay, and then see if I can share this. Okay, can everyone see that?
Yes.
Great. So on the right-hand side, you can see the auricle, which is the part of your ear that's outside. It's also known as a pinna. and that there are 109 acupuncture points in the ear. And with my cursor, I can show you that one of the common ones is called Shen Men, which means spirit door or spirit gate, and it's located right here. And it's really good for pain and stress. And since a lot of people are stressed out, if you use the Shen Men, but let's say someone has an issue with their shoulder, which would be down in this region here, and that, so I'll do Shen Men plus shoulder, and that helps ease shoulder pain. And there's actual studies demonstrating that you can needle those 2 points, and then the inflammation in the shoulder goes down using this infrared cameras for temperature. And so you can also use these seeds, which came from a Vicaria plant, which makes a perfectly spherical seed about 1/10 the diameter of a BB. And I have one here for those people who've never seen one. And I don't know if that, you can kind of see the holes for the ones that I did not use. And so they're quite tiny. They're about 1/10 the diameter of a BB. These are made out of stainless steel, but there's also ones with stainless steel substrate and a 14-karat gold overlay for a little extra bling. And that just the acupressure on those acupoints will have a therapeutic value as well. And that's why I do it, is so people can go home and press on them and get some relief.
That's awesome. I had somebody think they were like a piercing, and I had to kind of explain to them what it was.
That is believable. Let me see if I can get back to. Are you allowed to? Oh, there we go. Stop share. There we go. Okay. But there are some acupuncturists where that's all they use is auricular acupuncture. There's a colonel in the US Army that came up with a protocol with the ear that's called battlefield acupuncture, and they were able to drop opioid use by about 85%. So that instead of with morphine on the battlefield, they can actually just use this protocol. And we're talking about someone who's got their arm blown off. I mean, we're talking really, really serious pain. And they can use this protocol and then helicopter them to safety without the possibility of respiratory depression, which is what happens when people have a little too much morphine and they die.
Wow, I can appreciate that as an Army veteran and an Army medic. So that's very interesting.
Bill, could you talk about diagnostic techniques that you use? I know you often look at my tongue. Maybe you could talk a little bit about what you're looking for and what that means, and other diagnostic techniques that you use before you put in the needles.
Certainly. So there's actually auscultation. Auscultation is listening. And so you may be listening to someone's breathing. You may be listening to someone's heart. There is palpation, and palpation is not only the palpation of the pulses, but also you can palpate the meridians themselves, and sometimes you can actually feel congestion in the meridians. And based on that, say, oh, okay, this is blocked, and do a distal point in order to resolve it. The tongue diagnosis is quite complex, and I've got a nice picture here, so I'll go and share the screen again.
Ooh.
And you may have to move the people over depending on where your strip is. But you can see that in the center, this person has a very cracked tongue. And that indicates a long-standing yin deficiency. And in Chinese medicine, yin represents body fluids. And so it doesn't mean that they're really dehydrated? Not exactly, but a yin deficiency in Chinese medicine means that that they have a very difficult time sleeping. And they usually will have hot flashes because yin is cool. And if you have a deficiency in yin, you have a deficiency of coolness, which means that you get hot. You can see on the right side, this person, there's a map of the tongue in Chinese medicine, and there's different areas of the tongue that correspond to different organ systems. So the tip of the tongue represents the heart. And if the tip is red, that means someone has a lot on their mind. When you go to the edges, that's gallbladder and liver areas. And that if someone is quite angry, it can represent that. In the very root of the tongue is the kidney. And so if someone has infertility, a lot of times the root, I can check that out. And then the middle of the tongue is spleen, stomach, and many times people have a little crack there, and that indicates a long-term digestive issue. So just looking at the tongue, we're looking at shape, we're looking at the edges, and if there's teeth marks or scalloping on the edges, that would indicate again, digestive issues, either acid reflux or sense of bloating after they eat. And then, of course, the color of the tongue and the color of the coating on the tongue. If someone is sick with a cold, if they have a thick white coating, it means that their nose is running, but it's very thin. They have a headache, they have joint aches. If it's more yellowish, then that's more of a heat type invasion of wind, and they would have more of a sore throat and have a fever and a cough. And so without people telling me what their symptoms are, just looking at their tongue, I can usually get an idea of what steps I take. And so here's an image of a pulse diagnosis with a nice guy with the Fu Manchu. And you can see that the left and right hands have different pulses. So the left hand has, starting the distal, has heart, liver, and kidney that we check for. And then the right hand has lung, spleen, and kidney. So that can give us information. There are 34 qualities of pulse, depending on what textbook you read from. And that they have ancient names like string taut and rolling. If you have a rolling pulse, usually you're pregnant. So if I see a rolling pulse in a man, I'm greatly concerned. Actually, you can have a rolling pulse in a male, and it means that he ate a lot of food. If someone is really, really full, then their pulse will roll. Yeah, so there's a variety, hollow and full, and there's string taut and tight, and each one has a waveform associated with it that we have to study. And then in China, they actually created a hydraulically actuated model that simulates the 34 pulses to teach medical students. We did not have that in our training. We would just ask, we check the pulse and we guess and say, I think it's string taut. And then the professor would go check the pulse and say, you shouldn't be an acupuncturist. And I recommend that you leave the school immediately. But then over time, you're able to connect the dots and it's not as difficult. And then there's differential diagnosis. And just like in Western medicine, a differential diagnosis would be, okay, you come in, your nose is running, you feel miserable, you've got a sore throat. The next question is, well, have you been feeling feverish? Do you have joint aches? Do you have a headache? So obviously it's just a common cold. But in Chinese medicine, if someone has a menstrual problem, let's say they have a certain type of anxiety, you may ask, do you have clotting during your period? Do you find yourself getting angry easily? And those are the symptoms associated with a liver qi stagnation, which would lead to this anger. The liver is involved with anger. In Chinese medicine, just like just mind-body medicine today, the Chinese were very aware that each organ represents a a particular emotion, and that if you have too much of one emotion, then you can have an imbalance. And that can be fixed with either acupuncture or herbal medicine, whether you're really angry or, if you're really joyful, that could be a little bit manic and you could be bipolar, in which case that's not so great, and that you want to kind of, ease that down a little bit. So great question, Susan. Did that answer it fairly well?
It did. Yes, it did.
Great.
I have many more, but I'm going to let other people ask.
I'd like to move. I'd like to kind of know about pain relief and healing, because I have a variety of physical challenges, some of which is malocclusion and the joints. This just started 5 years ago.
Okay.
TMD from a dental thing that caused my bite to go off.
Gotcha.
And now it's very unstable. And there's many like decay and other things that have ensued since then. So it's like a intensive challenge. So I can't really my ability to eat foods has gotten much more narrow in terms of what I can eat. So I wonder about healing that. I wonder about healing digestive issues. And I mean, sometimes I have pain like in the neck, shoulder, which I have right now, but I was interested when you said you address discomfort on one side of the jaw to impact the other. And in what realms do you help people with healing the underlying energetics of a problem or the physical manifestation of the energetics, and kind of what is the process? And do people ever potentially come to you and do a, if their pockets aren't deep, just come for one treatment to get the most out of it they can instead of a series of treatments?
If a person has something that's quite acute, then my treatment plan is one treatment, and that can usually resolve it. Most people, however, come in and have a problem that's years or even decades old. And so that is a process, and that all I do is stimulate your body to heal itself. And so let's take a simple example of tennis elbow, which is lateral epicondylitis. It's where you have a tendon of your extensor muscle that's very inflamed. And so when you stick needles actually in your leg, there are studies that show that the inflammation in your tendon is reduced. So when you take an anti-inflammatory, let's say a non-steroidal anti-inflammatory drug like Aleve, that what it does is it's a COX-2 inhibitor. It inhibits cyclooxygenase, which is a chemical that's in a chemical cascade that leads to inflammation in your body. So when you take the drug, when that blood concentration level rises up to that therapeutic level, it will reduce your inflammation and reduce your pain. But is it actually healing you? And the answer is no, it's not. It's just reducing the inflammation to a point where hopefully your body will take over and heal itself. So with acupuncture, it actually does reduce prostaglandins and leukotrienes, which are also pro-inflammatory chemicals in your body, but it also stimulates your body to heal itself by increasing blood flow to the area and a number of other things. And they also have used infrared. So let's get back to your jaw. So if you look at the structure of your jaw, and for those people, see where this flap is? It's called the tragus. It keeps bugs from flying in your ear.
Oh yeah, I'm coming. I'm just 1 second. I'm listening. I'm not leaving. I'm listening.
Okay, so if you folks touch that and then open and close your mouth, you'll notice that the ramus, that jawbone, slides out from the temporomandibular joint and your fingers go in, right? So when you do it slowly, if one goes in before the other, then your jaw is not opening symmetrically, and instead it's opening like this. And over time, there can be damage associated with it, and a breakdown of that joint cartilage.
Yeah.
So, and there can be clicking and popping, of course, and all that as well. And so depending on an MRI or what the indications are, how bad off it is, a lot of times it's an imbalance between the masseter muscle, which is the big one that allows you to clench, and these smaller muscles called pterygoid muscles, which allow you to move your jaws laterally. And so if one side is tight, then it'll literally pull that joint over. And then when you try to open, it's not going to open properly. And then you release that pterygoid, and then it opens and closes more symmetrically. And the physical therapists will put on rubber gloves and go in and actually try to release the pterygoid, which is quite uncomfortable. I had it done because I wanted to know what people feel. I wanted to be on the receiving end of it so I could speak more intelligently about it. And they got on in there, and I was tapping the mat, and tears were coming down my face. It was not great, but it is one approach. So getting back to your question about muscles. So acupuncture can heal your muscles, your tendons, your ligaments, your the inside lumen of your blood vessels. It can heal your inside of your digestive tract. If people who have IBS and have quite irritation there, we can reduce that irritation. For people who have bloating after their meals, we can reduce the bloating. For people who have acid reflux, we can change the balance of their acid and alkaline in their stomach. If someone has very severe dysbiosis or SIBO, which is small intestinal bacterial overgrowth, that's something that acupuncture is not going to be very helpful with, and that there's other approaches like taking large quantities of probiotics and other things to try to create that balance. So there's herbal medicine that works great for skin conditions, and the acupuncture can work, let's say, for pruritus, which is itching of the skin. But there's other things where it's the go-to really is herbal medicine, and I usually refer out to herbalists that are quite skilled. And got a picture here, I believe, of herbal medicine. And so there you have what is herbology, which is Chinese pharmacology. We have 2,000 herbs in the Chinese pharmacopoeia. And that the way it used to be done in China is that you would get loose herbs, place them in a bag, and you would boil them until about a cup is reduced. You'd pour another cup of water in, boil them down again, and then strain it, and that's called a decoction. And you would drink it, and it would smell bad and taste worse. And that's very common in Chinese medicine. Now, if you look to your right here, that you can see that there's pills, and we also have granulars as well, so it doesn't taste nearly as nasty.
So if I understood back just to the joint TMJ, TMD, you can impact anything that might have a tendon, muscular, a physiological imbalance.
Yes.
But not, because I know like with Qigong or something, you can actually sort of restore tissue to a, you know what I mean? Do
Yeah.
energy work to restore cartilage and other such things. And I have to believe that acupuncture would be the same idea, because it's energy healing, energy, that it can facilitate a level of healing, the body's ability to restore things.
That's correct. NIH considers acupuncture an energetic healing kind of full system of medicine.
I'm just wondering if next steps with my jaw are to, because I haven't really explored. There's the whole dental side, which is like a bottomless pit of questions and unknowns. I'm just wondering what I could learn and from seeing someone like yourself with respect to this.
The other thing that's really, really helpful is craniosacral work.
Oh,
we have different plates in our head. You've got the frontal plate and the parietal plate and occipital plate. And sometimes you can have an impact that will jar it. And when it's jarred, then that will affect your jaw. And then it's off until you really correct the plates, and then your jaw will fall into place. And so there's a gentleman by the name of Dr. Alan Thompson in Fairfax, who is a really skilled chiropractor, and he does craniosacral work. So there's a lot of approaches, obviously, either a dentist, even surgeons work on TMJ, but unless there's something really, really severely deteriorated in the actual joint, I wouldn't recommend you go that route.
No, and then the dentist is, well, we need to move on to other people, but I've just found that people have, it's like going to a mechanic who says, well, I'm going to take the engine out and then we'll figure out what's wrong, as opposed to being more precise. I'm having the dental thing. The dental approach is frustrating me because it's so just come in, and after you spend a bunch, it's very I can't figure out the right word for it, but it's going to somebody who just says, come to me, and after you're here, then I'll tell you if it's going to be $10,000 or $20,000, or it's so expensively undefined. That's what I'm trying. So I'm just looking for somebody who can say, oh, okay, well, let's see here. If you know what I mean, sort of the frustration of something that's way too undefined and maybe impossibly expensive, or just somebody who can be a little more aware somehow.
Understood. And also, when you see an acupuncturist, typically they'll create a treatment plan for you, which will say, I want to see you twice a week for 4 weeks and then reevaluate. See, your bird's agreeing with me.
Yeah, but Betty agrees with a lot of people.
Maybe she's a poor judge of character.
I don't know. No, he tends to nod his head at the right moment. So he seems to be nodding his head right now.
Gotcha.
Yeah. Thank you for pointing that out, because I'm so used to having him there, I don't always notice.
Oh, he's just a yes man.
So, well, thank you for that. I appreciate it.
No problem. Anyone else have any burning questions?
I do have a PS. So you mentioned the guy with the cranial sacral who's where would you go first, to acupuncture or cranial sacral, or how would it, when you look at this, where would you start?
I mean, it really comes down to where the root cause is. If you did have an impact injury, and it can be relatively slight as well, then I would say go get the craniosacral first, because acupuncture doesn't work that great for structural problems. For instance, you could say that, let's see, what's a good example? Spinal stenosis, where you have calcifications that gradually grow into the spine, and then it squeezes on the nerves. Well, all the needles in the world aren't going to release that spine. And so that's something where actually is a surgical procedure where they cut through the dura mater, that very thick outer coating of your spinal canal, and that releases the pressure, and then the pain goes away. So the same thing is true for the craniosacral therapist, except that the pressure that they're using on your skull is that of the weight of a nickel. So it's very, very subtle. I mean, you barely notice that they're doing anything, and you're thinking, well, what am I paying for here? But the end result is pretty spectacular.
Okay, thank you.
Mm-hmm. And by the way, his name is Alan Thompson, Thomson.
Oh, okay.
And it's easy to find him in Fairfax because he's on, his clinic is called Neck, Back, and Beyond.
Okay.
So kind of a cute name, easy to remember.
Back and Beyond. Okay.
Yep.
All right, thank you.
Sure.
Hey, Bill, Jim Spengler.
Yes, sir.
From your lens of acupuncture, could you talk a little bit about what you perceive optimum health to be and how you get there?
Bam. See, he's actually a plant. I put him in just for that question alone. And what's really interesting is that last night I was on the phone with the former director of NCCIH, which is a woman by the name of Margaret Chesney. And she is the leader of the Osher Center in San Francisco. She's a PhD. And we were talking about how the healthcare system in the US is broken and that we really need health promotion and disease prevention instead of fee for service and just dealing with sick care. So the Chinese have an Yin Yang symbol. Let me see if I've got an Yin Yang symbol here. How can I have an acupuncture presentation without a Yin Yang symbol? I am just terribly embarrassed. So
We all know what it looks like.
good. So Yin Yang really is about balance, and that balance and harmony in the traditional Chinese medicine sense is optimal health. And that would mean that we're sleeping well and that we have good energy and that we're breathing deeply and that we're one with nature. And in the Taoist philosophy, again, if you live your life in the rhythm of nature, then you're going to be happy and healthy, which means that when strawberry season is coming, that's when you should eat strawberries. And then you're in the vibration of that particular season. So, yeah, so when we check people's pulses and their tongue, there is actually considered an optimal kind of signs and symptoms that we look for in someone who is optimally healthy. And yeah, so, and so yin and yang, if you have too much yin, then you're actually going to be a little bit cold and that your circulation is going to be poor. If you have too much yang, then you may be overheating in some way. An excess yang condition can be having dark urine, for instance. So that means that you are dehydrated because yin is fluid and you don't have enough fluid. So you rehydrate and that urine goes back into the optimal straw colored. So that's kind of it. You know, we're always looking for that balance. Does that make sense, Jim?
Yes, and the second part was what practice gets you there?
Okay, so in traditional Chinese medicine, the practices that we use are Qigong and Tai Chi, along with energetic foods that we, in the winter time, we eat warming foods, and that would include ginger and lamb. And in the summertime, we eat cooling foods, and that would be things like citrus fruits and tomatoes. But now we have hothouse tomatoes, and we can eat tomatoes in the winter time, which means that that's not really healthy. So we look at that. Definitely Qigong is something that from a Western medical standpoint, it increases superoxide dismutase, SOD, and that is an enzyme that is reduced as we age. And so when you do Qigong on a regular basis, you actually are younger on a cellular level. That when you do Tai Chi, that Tai Chi also has that also the end point of balancing meridians in our bodies, which means that we lubricate all of our joints through the movements that we do. And so we stave off osteoarthritis and other chronic illnesses that are age-related. And it also really, really, really helps with balance. And there's studies showing that people who do Tai Chi have a much lower % chance of falls as seniors in their 80s and 90s. It also optimizes digestion and it helps increase blood flow to the brain. So it helps with reducing the potential for dementia and Alzheimer's. And I think, boy, there's just a whole host of things that that are great about doing Tai Chi.
Is Tai Chi better than Qigong? In that, in all the ways you've just been saying? Because I have Qigong stuff I can practice, but not Tai Chi.
Tai Chi and Qigong, Tai Chi is the younger sister of Qigong, and Qigong goes back 80 centuries. So 8,000 years they were practicing Qigong. However, Tai Chi is relatively new and has only been around for several hundred years, and that it was a martial art that's done very slowly. And so Tai Chi Chuan, Chuan means fist. Tai Chi means supreme ultimate. So supreme ultimate fist or supreme ultimate boxing. And so that's what the original intent was along with that. And so some people will just take Tai Chi alone, which they say is more about promoting health and well-being and has no martial intent. So with that being said, I'd say Qigong is a little bit simpler and you get a great outcome. Tai Chi is quite difficult in the beginning. I'm a martial artist. I've been training for 45 years. And when I first got introduced to Tai Chi, I had 2 black belts. I was in my 20s. I thought that it would be quite easy, and I found out that it's not. And that even though I could do jump spinning back wheel kicks and stuff, for me to do snake creeps down and very slowly sink and have my leg go out in a very controlled manner was very difficult. So it just took a different skill set. And what's really interesting is that if you do 20 minutes of Tai Chi in a very low position, it's equivalent to 20 minutes of downhill skiing. So you do get quite a bit of cardiovascular improvement as well.
It sounds too hard. Because I don't think I could do all those weird things. I like when I've seen Tai Chi before with the just sort of fluid moving, like it's almost like dancing through air, those sort of gentle, slow movements, those feel really nice. But what you're describing, they're really harder than heck.
Oh, well, you know, when they start out, you start out almost in an upright position, and then as you get better, you get lower. So they're not going to start you out really low, or your quads would scream, and it would be challenging. Also, Tai Chi is meditation in motion, and that you're synchronizing your breathing with your movement, and that actually, let me back this up so you can see a little bit, is that when you're moving forward, that's yang because you're expanding. And when you're expanding, you're exhaling. And then when you're drawing back, you're yin and you're inhaling. So you're flowing from yang to yin in each movement. And that not only does it move the circulation throughout your body, but it also is just amazing for balance. And that you know, oh, I'm sorry. There's a measure that's called heart rate variability. And it's a measure of health, and that if you have a good number related to that heart rate variability, then you have what's called heart coherence. And there's something called heart math, which maybe some of you have heard of. And that when you do Tai Chi, that actually increases heart coherence and improves your heart rate variability, which means that you live longer.
Are there any like online DVD Tai Chi for, you know, and not only beginners, but beginners who weren't born yesterday?
I would recommend actually studying under someone, because then you can get the corrections. If you're watching a video and you're hunched over, then your chi is not flowing properly. And so when, just to give you an example, when you start out with the form and you're rising and you're falling, that you're shifting, as I said, from yin to yang, and that you're aligning this acupoint here, which is called by hui, up to the heaven, and meanwhile you're rooting your feet, which is the kidney, water, and fire points. And that's something that the instructor will tell you, and that helps you with your alignment throughout the form. And if you're just watching a video, then you're not really aligning things and then moving in the proper way. So I would say you may be able to mimic a DVD of Tai Chi, but how much value you get out of it would probably be minimal. And and there's a ton of Tai Chi practitioners and teachers locally. So it's not like we're in West Virginia where you may have to drive 45 minutes one way.
Okay.
What area do you live in?
I live on the border of Arlington and Alexandria.
Okay, so Arlendria.
Yeah, I guess. I don't know if it's not really called that, but it is. There must be quite a big border because I'm not in that area, but I am on the border.
Okay, all right. So there's a group that's called Peaceable Dragon. And Peaceable Dragon teaches not only Qigong, but also Tai Chi. I have no idea what they charge, but it's minimal. And the instructors, from what I know, are very legit.
Okay. Thank you.
And for those people who wonder about Tai Chi, there's actually more than 200 styles of Tai Chi out there, and that they're named after the families or the regions. Like Chen style was the Chen family from the Chen village. The Yang style, which is very common in the United States. The Sun style, the Wu style. So there's a number of common styles that have been brought over to the US and popularized. But in China, there is just a huge number. And that's true for Qigong as well. And I've been practicing Qigong for about 30 years, and that I've been introduced to a number of different styles which have similar roots as far as some breathing techniques and other things, but they're also widely differing as well. Anyone?
Bill, since no one else is asking anything, can I ask something about vertigo?
Oh, absolutely.
My sister has been diagnosed with vertigo, and she is so upset by it because she was standing on a counter cleaning her cupboards, and all of a sudden found herself unconscious, after, coming back from being unconscious on the floor.
Wow.
And and then in the process of falling, apparently she's wrenched her back, and now she's had 2 incredible bouts of vertigo. And when I looked at your tremendous diagram of the ear points, I
Yes.
thought vertigo has to be addressed in there somewhere because it's part of that inner ear canal. Can you give us any information on that?
Certainly. So there's certain types of vertigo, and based on what's driving it was how we deal with it, both Chinese medically and Western medically. The most common is called BPPV, which is benign, positional, paroxysmal vertigo. So that's benign, positional, paroxysmal vertigo. Paroxysmal means that it comes and it goes. And what causes it is otoliths. And an otolith is a small calcification within the semicircular canal in your inner ear with the fluid that is used for balance. and they're almost like the X, Y, and Z axes in mathematics. And that when I tilt my head this way, that equilibrium fluid will go to that loop and it stimulates the hairs and tells me the position of my body. When you have an otolith, it will touch hairs that tell you that your head is this way, and your eyes say your head is this way, and bzz, it spins your gyros. Similar to when you would get sick if you're on a boat and the ship is doing this, but you're inside the ship and your brain and your eyes are telling you you're not moving, but your inner ear is telling you rocking, and then that disparate data set makes you feel ill. And there's something called an Epley maneuver. That's E-P-L-E-Y, Epley, and named after the person that came up with it. And that she can do this Epley maneuver to get those otoliths back into a position that won't cause her head to spin. Typically, BPPV is presented as something where if you turn your head, whether you're flat on your bed and turn your head, that it will spin the room. If you have her shake her head like she's saying no, or nod her head vigorously, that can also trigger the bout. There's also Meniere's disease, and Meniere's is also a long-term issue that also is combined with tinnitus or ringing in the ears. And that's more serious and more long-term. She could throw a clot in her cerebellum, and that's the part of your brain that deals with balance, which can also cause things to spin. And that there are neurological tests that we do where we have people close their eyes and touch their nose and their palm and touch their fingers together. And the reason why a police officer will have you follow this is because when your cerebellum is damaged and you look down and to the right, when your muscle contracts, it'll start to wobble, which I can't simulate, but that's called endpoint nystagmus. And that's the reason why if someone is struck in the head and they're wondering, is there any cerebellar damage? If someone falls backwards, that they'll do this test as a very common neurological test as well. There's about 8 different things that can cause vertigo, but those are the two or three most common.
Wow. Wow. Thank you.
And that acupuncture is very effective at dealing with it, as well as some herbal medicine as well.
Okay, so is acupuncture better than chiropractor? Because she was recommended to go to a chiropractor who kept saying, I can help you with the crystals in your ears. And I noticed you used the word crystal or calcification.
Yeah, so otolith and crystal are the same thing.
Otolith and crystal. Okay, same
Yes.
thing.
Mm-hmm.
So in your estimation, chiropractor or acupuncturist, which would you go to first?
You know, it's a Venn diagram, and that what they do and what we do are overlap in terms of what conditions we treat, but we treat them from a different angle. And what they tend to do is they'll take an ear very, very firmly and they'll tug on it, and you'll hear a pop, and that can open up the eustachian tubes, which can sometimes also assist in reducing that vertigo symptom.
Okay, but you've worked with people who have had vertigo.
I certainly have.
Okay.
Yeah, acupuncture is effective, and I would assume that chiropractic is also quite effective. Like I said, the Epley maneuver is something that's very simple that you can YouTube. It takes less than 5 minutes to do, and if she gets relief from it, the thing that's tricky about it is timing. Is that if you move your head from one side to the other, from 45 degrees this way to 45 degrees this way when you're flat on your back, and you do it too quickly, then those crystals don't have enough time to settle.
Sure.
You wait too long, then they get stuck and then they won't move, when that's what you're trying to do, is just move them out of that circle to a place where they're not tickling those hairs and giving the wrong information to our brains.
Wow. Okay. Thank you. Yeah.
Sure.
Thank you.
Glad to be of assistance.
Yeah.
It would seem to me that the way in that door would be more gentle with the acupuncture.
Yes, but if the person is doing craniosacral to help assist that condition, then that's a pretty gentle approach and no real neck adjustments or anything. And people are frightened about neck adjustments, and some people have heard that there can be some carotid artery dissection where there's actual damage to the carotid artery. And I would just like to say that that's extremely rare, and that the physicians who found out that it happened once in Canada that may or may not have to do with the neck adjustment, that they were all over it to say that, chiropractors are dangerous. But the reality is that there are more than 100,000 deaths due to the proper use of medication in this country. And so if you do everything your physician recommends, more than 100,000 people die. And the number of deaths due to chiropractic, I think, are zero. If there has been a death, I'm not aware of it. I do know the statistics for acupuncture, and that is zero in this country for the past 40 years. But acupuncture is not 100% safe, and that there are people in China who have been practicing because their uncle practiced and they swept floors for their uncle and hung up a shingle and said they're an acupuncturist without really deeply knowing regional anatomy. And they've deep needled acupoints here that punctured the brainstem and caused a brainstem bleed, and the person died. They can deep needle points here where there's the apex of the lung that, again, you can puncture and get a pneumothorax, which won't kill you, but does require medical intervention.
Hopefully we still have some people online. So please, I think I just can't get over how much information you have at your fingertips. So I really bless you for this, Bill, because this was just fantastic for those of us who find acupuncture so valuable. I know in my case, once a month is my maintenance schedule. And I have tried in the past to say, well, can I get away without it? Doesn't work. I can go 6 months, I can go a year, and then all of a sudden I'm in excruciating pain. And then I realize this isn't worth it. And I know it's because my body isn't flowing properly. And your work has totally prevented me from having to go through any major spasms of any type since I've been, coming. So.
And that's something that in China is very common, that we do use it as a preventive measure. But here in the United States, the paradigm is don't fix it if it ain't broke. And so unfortunately, 95% of my patients are coming in for something very specific. And when that problem is resolved, they leave, which is fine. And I'm happy with that. But there's a few patients who come to me just because, maybe once every 4 weeks or so. And they don't have allergies. They don't get sick when autumn comes. They their energy level is good. They're sleeping well. They're digesting well. Their elimination is balanced. I mean, it just maintains everything, and that there's very subtle cues that acupuncturists look for, and that's a reason why the point combinations change. And just for your edification, folks, is that there are point combinations for everything. And you would have to be a walking encyclopedia to know the exact point combination for Parkinson's disease versus, ALS. And so they created a philosophical underpinning so that you don't actually have to remember all of the point combinations, but you're looking at the symptom map, and based on that, you're able to choose point combinations. And after a while, as an acupuncturist, someone says, oh, you know, my shoulder hurts right here, and anterior shoulder pain, 4 points, and it goes away. And so each acupuncturist has their own favorite points, but if you have 6 acupuncturists in this room, we would all agree that there are very certain point combinations for digestive issues and for sinusitis and all the common things that we see, and that we're actually trained as barefoot doctors in China, where we go to provinces where the nearest hospital is 200 or 300 kilometers away. And so we just deal with people who have dysmenorrhea or painful periods, people who have anxiety or depression, or who have some type of tendonitis or back pain, and that just with needles alone, which are very easy to transport, we can solve their problem. I'll fish around just to do a little show and tell for those people who haven't been to an acupuncturist. And this is what the needle packaging looks like. And the blue part is the handle, and then there's the body of the needle. We're not allowed to actually touch the body of the needle when we're inserting it, because even if we've washed our hands, there's a potential for the bacteria of our hands to get on that needle. So they're individually packaged, they're used once and discarded, and of course they're sterile. We also have items like this, which we didn't have 2,000 years ago, but this is a device that can be used to check for paresthesia, or altered sense of feeling, in people who may have a compressed nerve in their neck. I have them close their eyes, and what they'll say is, oh, it feels prickly here, and then I go over there and they say, it feels just like I'm rubbing. And what I'll also do is I'll roll the tool, and then I'll switch the tool for my finger and go back and forth and ask them if they can tell the difference. And then their eyes are closed and they go, no, it feels the same. We also have gua sha, and gua sha are tools. The term gua sha means scrape red, and you can see the gentleman how his back is very red here. And so the Chinese will take these tools and scrape the skin, and that's called petechia, which means that these tiny blood vessels are broken, and it stimulates IL-6 and other interleukins, which are involved in your immune system. And so if you have a common cold, you can scrape someone's back, and next thing you know, they're dumping out IL-6, they're dumping out new white blood cells and other things to get them healthy again.
Okay. And I think Joe Powers was on, and not Powers, Pitcher, Joe Pitcher, and I think she had a question.
Sure.
Yes, thank you. Thank you for, first of all, thank you for this talk. I'm always excited when you're here. I learned so much.
It's very kind of you.
Oh, it's true. So I have an issue with my shoulder, and I'm told I need a reverse shoulder replacement.
Okay.
I saw you just before my ankle replacement, and I had a foot surgery right after that. And I think I was just on crutches too much. And I had also, over the years, lost 2 tendons in my rotator cuff. So my question for you, it was the long head biceps and the supraspinatus, if that matters. My question, a couple of questions. I'm hoping that what I've done is just injured a tendon, ligament, muscle, something that has inflamed the shoulder, which is really, it's very arthritic at the AC joint. And if I can reduce the pain and swelling and coast along and facilitate healing in whatever way I can, I'm hoping that things will come back together where I can be at where I was before all the crutches.
Okay.
And I was already missing those tendons. So I didn't put that together very well, but I'm hoping it made sense.
It certainly does. And that when you have a joint dysfunction, meaning that just like with the jaw example, where you've got a muscle that's a little tight on one side and then the jaw doesn't move properly, same thing is true for the natural movement of your shoulder. And that if you have a tendon that's removed, then the whole balance of your shoulder is thrown off, which means that now you can have excess wear on a particular part of your cartilage, which can be problematic. The definition of osteoarthritis is the gradual degeneration of articular cartilage, and that as that articular cartilage breaks down, you start having clicking and popping. If you look under a microscope, it looks like a golf ball, and that over time it becomes thinner and thinner, and it can that inflammation is just going to continue. So one amazing thing is PRP, which is platelet-rich prolotherapy, and also stem cell therapy. Finally, you can inject ozonated fluid into your joint, and so it's called prolozone. It is considered an experimental procedure, but I've been impressed with what the outcomes are in these studies.
I did PRP and platelet lysate and everything expensive. I mean, I spent thousands trying to avoid the ankle replacement, but it turned out I didn't have enough cartilage left where that would be helpful. So I don't want to go down that route. I'm
Okay.
sorry.
The other thing that I wanted to mention is that when you get to end stage osteoarthritis, similar to if anyone has done rock candy as a child, you'll take water and you'll put sugar in it, and boil, more sugar, until finally it's super saturated and that the sugar will no longer dissolve. Then you make it go to room temperature, and then you take a string with just one bit of sugar on it and you stick it in the cool water, and all of the crystals of sugar come out of solution and jump on that string. So the same thing is true as with acupuncture, is that if you have cartilage to work with, then those chondrocytes, which are cartilage cells, can replicate and you can get more. But if you have such a small amount to begin with, then the acupuncture won't stimulate it enough to actually build it thick enough to get a positive result. And I spoke to a professor of mine when I had maybe 5 years experience. And I said to her, I've got a patient with knee pain and he's in a lot of pain and it's bone on bone. And she said, he needs a knee replacement. She said, if it truly is bone on bone, that periosteum is just very sensitive and is very innervated, and that just the weight of his upper body on it is just going to cause pain and inflammation forever, and the acupuncture will not be effective.
Okay. Now the second thing you mentioned that had ozone.
Yes.
What was that?
It's called prolozone, and it's pretty impressive. Ozone is something that when bubbled through a solution that includes B vitamins will cause a bit of irritation in your joint, and from the irritation, there's stem cells that are produced that will rebuild your joint, and it can be used for herniated discs. It can be used for most joint spaces, whether you're talking about your elbow, your shoulder, or your knee. So you can Google it and go to National Library of Medicine, nlm.nih.gov, and then click on PubMed, which is their kind of, that way you know that they're strong studies that are published there.
This would presuppose that there was some cartilage left.
Yes.
just like with the one that we talked about earlier, the PRP. Okay, and there may be that uh, hmm, I'm just not ready for a shoulder replacement, so I'm really willing to try things. Do you have people that you recommend that do this work if I should decide to give it a shot?
No pun intended.
Yeah, exactly.
Certainly. So there's a woman named Haejin Kim. Her name is
Uh-huh.
Haijin Kim, Kim, and she's located in Annandale.
Hmm.
And her website is healthbuilders.net.
Okay.
And she's an MD, and she's brilliant, but not full of herself. And she's got a heart about the size of this room.
Oh, I
And
like that.
and I have been referring her patients for the past 15 years because she's that good. Um,
Ah,
the other thing you may want to consider is Feldenkrais. And
mhm,
Feldenkrais, you have people who literally just can't move their joint at all.
mhm.
And they do these micro movements where you're almost visualizing movement at a molecule at a time. So your physical body isn't moving. And then over time, you get full range of motion. How it works, I don't have the foggiest idea. But I did attend a class and I was quite impressed with it. So you can check out Feldenkrais, spelled Felden, Kreis, Krais.
Okay. And you don't have a practitioner then that you recommend for that, I imagine.
No, there's a woman in Arlington that I heard has quite a bit of experience and is very good. The other thing you may want to consider is maybe cold laser, that a laser might be able to improve some of the tissue. You may also want to go PEMF, which is pulsed
Ah,
electromagnetic frequency.
yeah, I have a mat.
Okay.
In fact, I have a wand and a whole bunch of things. So I'm working on those. I just was just seeing what else you could add to the mix here. You have some suggestions that I will definitely follow up on. So I know we're
Certainly.
going to run out of time here. Thank you so much.
Sure.
Thank you for this, and thank you for the whole presentation.
Oh, no problem. The one other thing that's pretty helpful is called Baxyl, Baxyl.
Right.
And Baxyl is hyaluronic acid. It's the stuff in our cartilage that makes it hydrophilic. And
Yeah.
it's so much better than glucosamine and chondroitin. And it's just a really impressive product. It's made by Cogent Solutions. And it's really my go-to. I can't keep it on the shelves because I don't care what a manufacturer says, because usually they're lying or they're at least bending the truth. But I do believe what my patients tell me. And my patients absolutely rave over that product.
Isn't
Thank
that an
you for
injection?
reminding me
I,
about that because I actually was, I'll just finish this thought and then you can jump in. Um, I was being muscle tested with regard to my supplements, and we got to the Baxel, and she tested me. She said, "Oh, that's good. What is that?" So I thought I'd give you that little bit of feedback. Thank you for reminding me about the Baxel. I'm on it.
and for people who don't know, it's a liquid supplement. It's over the counter, and it doesn't taste like much. It's got a thicker consistency.
What do you think about the injections of hyaluronic acid into joints?
I think that it's another method to get it in there. That hyaluronic acid is sometimes people use like what do they call that? Is it turkey combs, like that's got a lot of collagen in it, and so they believe that if you kind of eat collagen, then it'll produce collagen. But a lot of times, once some of these things get into your stomach, like shark cartilage, your acid in your stomach actually breaks it down and cleaves the proteins, and then you're left with some amino acids and whatnot. But you really don't have the original substance that feeds it. But hyaluronic acid is something that they found a delivery method that can, in fact, is bioavailable, and that your body can absorb it and use it directly into any cartilage in your body, whether it's your spine or the cartilage in your knees.
Oh, that's
And
very
that's the
good.
beauty of it.
Is it vegan? This one, Baxil, is it vegan?
Yes, it is vegan, actually.
Is it very, very expensive? It sounds very, very interesting.
It's only $8,000 a bottle, and you only need 6 bottles.
Ah,
I'm kidding. It's $40 a bottle, and one bottle lasts about 4 to 5 weeks.
well, that makes $40 seem really reasonable compared to the 8,000.
Yeah, click I use.
Okay, and you sell it, do you? I'm very intrigued.
I used to in my private practice, but now that I'm at a hospital system, we don't really have an inventory.
Oh, you're not a private practice person anymore?
No, ma'am. I was in private practice for 20 years, and I transferred over to a Nova hospital system about 1.5 years ago.
Oh, interesting.
Yes.
I have a
didn't know
question.
they had acupuncture as part of their thing.
Yes, they had a traditional medicine department for about a decade, and the guy who was the lead is Thai, and he decided to move back to Thailand. And he actually contacted me and said, "Hey, I think you'd be perfect to take my position." And I said, "Thank you, no." And we went back and forth, and now I'm there.
Okay, so you don't sell you work. So you're at which location?
Fairfax.
Fairfax. Okay.
I heard that there was another question that popped
Yeah,
up.
I had a question about bone stimulation from acupuncture. So can the bone growth be stimulated through acupuncture
It absolutely
or
can.
bone density?
And yes, both. And that there are acupoints that help with reducing and reversing osteopenia and osteoporosis. If someone has a fracture, then we will stick needles in on either side of the fracture and then use a very specific frequency of electricity that we literally clip to the needles. And so that's called electroacupuncture. And so you can Google electroacupuncture and fracture healing.
The reason why I asked is because I had a bone density done last week, and it was normal, but it was an improvement over one that I had done about 2.5 years ago.
Okay.
And I was, and I've been getting acupuncture almost about 2 years consistently. So it just made me think of that. So thank you.
Certainly. And a few things you can do to move that along is, number one, try to avoid any acid producing foods, because when your body is acid, you try to balance the acid. In chemistry, you learn about a buffering agent, and that's a salt. And so when you're very acidic in your body, your pH is low, then your body will reach out and grab calcium salts out of your bones. And so that's the reason why children are having fractures at 8 and 12 years old, because they've been drinking Coke, which is highly acidic. And the phosphoric acid in the Coke and the sugar actually makes them quite acidic. So if you make your body more alkaline, which is all the vegetables make you alkaline, most fruits make you alkaline, taking Bone Builder by Metagenics is amazing, and it has hydroxyapatite in it, as well as boron and silica and magnesium and vitamin D, which are all part of the bone matrix that will help solidify your bone. And the final thing you can do, especially if you're an older woman, is to do resistance exercises. And by just using either rubber bands or actual weights, that the tugging of your tendons against your bones will cause your bones to become more dense. And the reason why men have less of an incidence of osteoporosis compared to women is because we have greater muscle mass, and therefore we have less bone deterioration as we age.
Yeah, I do take the vitamin D supplements, and I've been taking those for several years. So that does help, but I'll look at the silica and the boron.
Yeah, if you like cucumbers, silica is high in cucumbers. So you put them on your salad and get a decent amount of silica from that route as well.
I think I found some in the homeopathic pellets too.
Nice.
So yeah, thank you.
Great. I know we're coming down to the end. Is there anyone else that has any burning question before we close up shop? Well, thank you so much for your time and attention. I was hoping for a larger crowd, but I think that this more intimate gathering was really helpful. And I hope that I was able to provide information, and that if you have any other questions post, feel free to reach out to me. And I think that my email address is on the advertisement.
That's right.
Great.
Yeah, absolutely. But thank you so much, Bill. This was just wonderful. I literally felt as if I was listening to a panel of 5 doctors sitting in front of me. You know, you have so much knowledge. It was such a pleasure listening to you. And I thought every question was very well thought out, you know, that and very, very important. But if you'd go back to the regular screen, then because I can't see any names. Great. And so we'll do our prayer. And so we'll finish up with our prayer. So I so thank you again. And
Thank you.
yeah, we'll if everybody would very gently close their eyes, take a deep breath in, exhale. Dear Mother, Father, God, Divine, Infinite Spirit, source of all that is, we thank you once again for the wisdom, the knowledge, the understanding, and the willingness to share what he knows that Bill Reddy, the acupuncturist, was willing to share with us today. And the breadth of his knowledge is breathtaking indeed. And we ask for healing for the following: my son, my daughter-in-law, my grandbaby, who will soon be 5 years of age, the Jones family, Sweeney family, Zarnopis family, the entire political process, Mother Earth, and anyone, whether they are on the earth or in spirit, that feels desperately in need of healing. And we will go with Bill. I'll have you go next.
Oh, I would just like to promote healing for anyone who's suffering with COVID.
Okay, thank you. And Carol?
I pray for peace on earth, for all living things. I pray with all my soul, God, that the human species become harmonious with all the other species and all of nature, and live as one family, and allow all of nature to assume its right and its space and its place and its needs met. I pray for peace and love and health for all beings of all life forms everywhere on earth, and a correction and a healing to the ecosystems that have been damaged and the species that have been compromised. I pray for what is possible here, our heaven on earth, and I thank you.
Thank you. And Joe?
I pray for all who are here this evening for their various needs, spoken and not spoken, for my family, my friends, for all who suffer in any way, and also for my cats, Rocky and Zen.
Super. Thank you. And Kathy? Okay.
Kathy is muted, so
she's
she
muted. Asked to unmute. All right. Well, maybe she'll come on. Montian.
I pray for peace in homes where there is no peace. I pray against the spirit of violence, and especially gun violence that has been running rampant through this country. I pray for everyone on my prayer list, who are dealing with various forms of sicknesses and loss and grief. And I just pray for myself to continue to be strengthened to do all the things that I'm being called and led to do. And I'll also continue to pray for my family always, those that live with me and those that are all over this country.
Thank you. And again, Kathy, if you can unmute yourself, that would be great. Okay, because she's not going to. And Montienne had excellent presentation. Thank you so much, Bill. And from Susan Aberson, she said, Bill, this was great. Thank you for sharing the link with me. Headed out to walk the dog now. Best, Susan. And I do want to invite you to next week. It's going to be, Wanda will be back on for the first time in, I don't know how long, 2 years, something like that. And because I'll be out of town. And so then she's going to do June and I'll do July, then she'll do August, I think, and September. Yeah, August and September. Then I'll do October and November because again, I'm out of town. Again, we thank you for being here, and we will have, we welcome your contributions, and we thank anybody who has contributed, because that enables us to keep going with this. And I hope to see you next week. And Joe,
I was just going to say, could you invite in the archangels that you usually do, or do you not have time?
Oh, yes. I didn't finish my prayer. Oh my God, yes. Thank you.
I love that part. I really
I
feel
know.
it.
I know.
Very selfish of me. I've got to have that.
Right. This is the second part. All right. Okay. And we ask for the presence of the angels, the archangels, the ascended masters, the Reiki masters, but most especially Master Jesus, Master Buddha, Master Katumi, Saint Francis, Saint Germain, Saint Gabriel, Saint Raphael, Saint Michael, the Blessed Mother, the Divine Feminine, Mary Magdalene, Moses, Metatron, Melchizedek, Mohammed, and Kuan Yin. We ask that we be cleared, centered, aligned, balanced, and grounded, and that everything that come in for us, come in for our highest good. We also ask to be clear channels of light for Metatron and his healing angels. We also ask for the assistance of the great rays, the lords and masters of the rays, and the archangels of the rays. And we also ask for the help and the assistance of the Elohim, the creator gods. We ask all of this in the name of Jesus the Christ and in the name of I am. Amen. Namaste.
Amen. Namaste.
Amen.
Thank you. All right. It was such a joy, Bill. And I will send the recording to you so that when you can forward it to your patients, you have it. Because I felt, like I said, the questions were fantastic. They were very well thought out questions, and they covered such a gamut of information. And I know you're not trained as a medical doctor, but you sound better than any medical doctor I've talked to in maybe the last 20 years of my life. So,
Great.
thank you.
Thank you.
All right.
Yes, thanks again, Bill.
Thank you.
You bet.
And
Thanks,
Thank
Bill.
you. Great job.
Have a
Bye,
good-
everybody.
Good night, everybody.
Good night.
Good night.